how do we take limited resources and stretch those resources so that they're available to the much wider populace? So let's talk about this whole issue of dialysis. The first thing is, what is dialysis? I don't know if you did science in secondary school, but for those who did, they probably remember something called, or remember hearing something called Graham's law of diffusion, which, well, when I was in high school, I couldn't understand what the purpose of learning this was. But basically, it's just a simple process of taking a semi-permeable membrane. Think of when you would make tea in the morning. When you take that tea and put it in the water, after some time, the concentration of the water changes. And some of the material which was at one point inside the tea bag seeps out into the water, but the tea particles remain within the bag. In honesty, this is what dialysis is. We are taking blood out of the body, putting it through a filter, and using a solution to clean the blood and then return the blood to the patient. At its simplest form, this is what dialysis is, or this is what hemodialysis is. There is another form of dialysis, which I think you mentioned towards the beginning of the program, called peritoneal dialysis. Peritoneal dialysis involves putting a tube, or what we call a catheter, into the abdomen. Now, the lining of the abdomen, anybody who's ever seen the intestines of something that's being prepared sees how smooth that lining is. That lining actually can absorb fluid, and it can also serve as a means of getting waste out of the body. So you can actually put fluid into the abdomen, allow it to sit. It basically cleans the blood, and then you drain that fluid out. So this is what we call peritoneal dialysis. Peritoneal dialysis is currently not practiced in Ghana. And peritoneal dialysis is cheaper than hemodialysis. So this is one of the things which the International Society of Nephrology has suggested, that pursuing peritoneal dialysis as a means of treatment will lower the overall cost for our patient populace. Now, hemodialysis, from a technical perspective, is slightly easier to perform than peritoneal dialysis. But I can tell you, all of my patients who are on peritoneal dialysis prefer it to hemodialysis, because with peritoneal dialysis, you don't go to the clinic to get treatments. You do the treatments at home by yourself. And much as kidney doctors like to think of ourselves as nice people, our patients don't want to spend several days a week coming to visit us. I'm sure Major will bear.
What is the barrier, Doc? Why don't we have peritoneal dialysis in Ghana? Do you know?
Expertise. I would say expertise is the biggest issue, and a desire to make it happen. If we as a country feel that this is important enough for us to do, we can make it happen.
And you are sure it's cheaper than hemodialysis?
I am 100% sure it's cheaper than hemodialysis. Not only that, it's practiced in Kenya, it's practiced in South Africa. These are countries which are somewhat similar in setting to us. So if it's working in Kenya, why is it not possible for it to work here as well?